Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. In honor of Rory McIlroy winning the Masters and completing the Golf Grand Slam, I decided to just come and do this video in golf attire. Yes, I do play golf, love golf. I'm an 8 handicap. The lowest I've been is a 4. And just love golf. Yes, I do have a yellow golf bag. Yes, I do have some yellow clubs. Yes, my putter is yellow. So I have a vintage yellow zebra putter, which I love. Today's topic is extremely important. I think it's becoming an epidemic. And the epidemic is all the neck injuries that are occurring in toddlers. We're going to see a toddler in this video, a case study in children, in preteens, and then teenagers. We all know that kids are more looser jointed than us adults, right? They're made that way. Like, they have a lot more cartilage in their body and they're more bouncy than the rest of us. But as you'll find out, they're very prone to getting the same injuries that we get in adults, and they can have the same symptoms that us adults have. When you have ligament damage in the neck, and a 2-year-old who's looking down at a tablet on the ground, and the 2-year-old has a humongous head and a little neck, I assure you that they're having changes in their neck structure, and these changes in their neck structure and the looseness or injuries to the ligaments can cause the same things that occur in adults, which is jugular vein compression, cerebral spinal fluid blocks, vagus nerve degeneration or vagus nerve injury, and ultimately, same thing that occurs in adults, you can get intracranial hypertension. And when fluid starts putting pressure on different parts of the brain, in this one, we just talked about the motor area of the brain. So the motor area of the brain is right there. And when there's too much pressure on the motor area of the brain, regardless if it's a kid or an adult, you can get poor coordination, difficulty with fine motor movements. You can start getting tremors, involuntary movements. You can get seizure-like activity. You can get blanking out episodes. You can have increased tone or decreased tone of the muscles just from changes in the bony structure of the neck, causing a block in the fluid flow out of the brain, and then ultimately you get motor area dysfunction, or whatever part of the brain where the pressure is, you can get dysfunction of that part of the brain. This is a 9-year-old, so this is a 9-year-old that we saw. These are the scans that we did in the 9-year-old, had all kinds of symptoms. You see that the 9-year-old lost the cervical curve, so they don't have the cervical curve. They have a forward head of like over an inch. So they have a forward head over an inch, lots of instabilities, inflection, extension, and at the atlas. And this is what we don't want. We don't want this. This is another child that I saw, with lots of instability. So you don't want that. Obviously, there's times where parents, they need a break, so the kids got to entertain themselves. My advice is have the TV up high, and if you want to put something on the TV, you got to have them looking up. The kids got to be looking up, not looking down, right? So you see all these things, right? Look at this, tablet ownership by age. Do you think a 2-year-old should really have a tablet? Do you really think a 4-year-old should have a tablet? It's unbelievable how many parents got to take the kids to the ER because they have all these health problems. And a lot of it can stem just from too much time with tablets. This one just shows all the different symptoms that you can get when the brain pressure gets high. If it's a neonate or a very small child, the head circumference can go up. But kids can get loss of memory, loss of attention, nausea, and again, like I said, they can get all kinds of like tremors and blanking out episodes. And I would even say to parents, when you go to a doctor and they use the term functional, or they use the term psychiatric, or it's a psychological problem or a functional problem, I would be very cautious to label something that. Like, in other words, if a kid all of a sudden is blanking out and nobody knows the cause, it's easy to say, oh, it's psychological or this or that. But the point is, if you have things happening to your body, so you're an 8-year-old, say you're an 8-year-old girl and you have these things happening to your body, are you not going to be really, really anxious? So when a doctor makes a diagnosis of functional or psychological, I would encourage the parents to get tested for things such as ligamentous cervical instability, especially if your kid is totally fine, they're a great kid, and all of a sudden they have a major personality change. Get them tested for ligamentous cervical instability. Look at this, right? When a child's born, the head to neck circumference, like in other words, how big is the head compared to the neck? It's 3.7 times the size. But as an adult, it's 1.6. At 2, it's 2.2. So in other words, a 2-year-old has this big head and a little neck. So these big heads and the little neck cannot be looking down at a tablet. It's very, very bad for them, and you could end up where your kid's in the ER. Why all of a sudden do we have all kinds of peanut allergies, right? All these life-threatening allergies, like why? Well, it can stem from all this stuff. Because if the kid has a reversal of the curve, which is easily going to happen if the child is not looking up and they're looking down, you can get vagus nerve degeneration, leading to leaky gut, leading to all kinds of food sensitivities, even life-threatening food sensitivities. So everybody needs to be aware of this. The pathophysiology of cervical instability and common symptoms produced in children, adolescents, and teenagers. CSF is blocked. They can get pressure, headaches, blurry visions, skin, light, and sound sensitivity. So if you have a child and you can't touch them because they're so sensitive, they can't be out in bright lights. They start saying, Mommy, my ears are hurting because I have sound sensitivity. It can be from upper cervical instability. So when the neck curve changes, it can also cause a block or injury or irritation of the spinal accessory nerve, which causes this muscle and this muscle to constrict. So then the child might, like if you have a kid and they seem to want to turn their head one way and they have a trouble turning it the other way, that's called cervical torticollis or dystonia. So that again is a neck problem. If you have decreased blood flow in the vertebral arteries, meaning you have so much instability in the upper part that the child turns and all of a sudden they have a drop attack, they faint, or they're vertigo and they're all of a sudden nauseated and their heart's going boom, boom, boom. Again, that's a sign that it's likely upper cervical instability. And that can also lead to seizures. We've had children where it led to seizures. Upper cervical instability can cause cervical vagopathy or a block or a decrease in the vagal tone. When you have a decrease in the vagal tone, you can get intestinal permeability. Increased intestinal permeability, or what they call leaky gut. So leaky gut can lead to digestive issues, excessive body inflammation, nausea, autoimmune disease, gastroparesis, anxiety, depression, obsessive compulsive diseases. It can lead to dysautonomia. So if you've had a child, a teenager that was diagnosed with POTS, postural orthostatic tachycardia syndrome, or mommy, my heart's going boom, 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 or I feel like I'm dying, or you go to the cardiologist and they say the child has a heart arrhythmia or they have tachycardia or even low pulse. Think of, they probably have an injury to their vagus nerve that's from the neck. When there's a lot of instability in the upper part, it can irritate the C2 nerve, which can give you lanciating type pain called occipital neuralgia, can give you migraine headaches. When there's lower cervical instability, you can get pinching of the nerves, you can get pain down the arm. You can also get mast cell activation syndrome. Now that may come from increased intestinal permeability, and there are tests that at holistic healthcare providers they can get for increased intestinal permeability. Dysautonomia also can give you mast cell activation syndrome. Now, in this condition, basically you get all these hives. You get all these hives, and it just occurs. Sometimes it's not even clear what causes it, but I look at it as there's an imbalance in there's too much sympathetic tone compared to parasympathetic. Parasympathetic electrical activity in the body is through the vagus nerve. The vagus nerve is what calms the body down, stimulates repair, stimulates healing. It's how we sense love. It's what occurs when you're with friends and you're laughing. So imagine a child who, and you know, kids laugh like 100 times a day and us adults laugh like 10 times. So kids, all the time when they're laughing and they're playing, they're stimulating their vagus nerve. Well, imagine if a child, their vagus nerve was injured. Then all of a sudden you see like, geez, my child isn't as happy. They're a lot more anxious. You know, things are happening to their bodies, or mommy, I have a stomach ache. These are all signs and symptoms that the child has probably a neck injury. So basically I basically got a text from somebody that I know, parents that I know, and they were taking their child for the third time to the ER. So they were in a car accident, and they got checked out, and then basically what happened was their child ended up with something, and they were on their way. So watch, the child's in the car seat. They're basically on their way the third time to the emergency room. And you see all these involuntary muscle movements, right? Okay, then watch it again. Now this is when the child's up. Same sort of thing. See? Do. So the motor area of the brain, if the pressure is in the area where it's the legs, the part of the brain that controls the legs, then you're going to get tremors in the legs. Basically, the child had a whiplash injury just like the parents. And then I'll explain what we did. So by 9 weeks, inside the womb, the baby has a lordotic curve. They have a lordotic curve. And what a child's supposed to do is to be looking up, looking up, looking up. They are not supposed to be looking down at a tablet or a cell phone. So this is my great nephew, and Michaela's here, his mother. So this is Levi, and this is just, you know, this is just a Levi looking up, looking up, looking up. And Levi has a great cervical curve. So the child that was having the tremors, this is what the child came in with. So the child's 2 years old. Then we explained to the parents about the child has to look up, look up, look up, look up. In the bed, they have to be extended, and we help the parents figure out how they can have the child look up, look up, look up. And then after, this was probably after like 6 weeks or so, the child had a nice cervical curve. And since we talked to the parents, the child hasn't had any seizure-like activity or tremors. All of us, including children, have to be weary of this, and we have got to have really, really good posture. And if the kids don't do that, they're going to get all the sequelae of ligamentous cervical instability, which leads to cervical destructure or breakdown of the cervical curve, which can cause blockage or compression of the internal jugular vein, and injury or blockage of vagal nerve inputs, or even vagus nerve degeneration, causing a host of symptoms. So a much easier thing to do is let's all of us have really good posture and be careful of how much time we spend looking down at a cell phone. And if we all do that, we're going to live healthy lives.